Hi folks, this is John Adamson, the Rehab Documentation Guru, and tonight I'm going to talk to you about another denial trend, and this is related to those that work in a SNF setting, Part A. So if you're not in that setting, this will not apply to you. Right now, we're getting a slew of denials, and this is likely impacting the whole country, related to speech therapy services or perhaps even OT going in for patients that have cognitive dysfunction. That's the reason for referral. When the BIMS score is not demonstrating cognitive impairment. Now, what do I mean by BIM? Well, that is an instrument. I'm blanking on what the initials mean right now, but it is a mental status screening tool used by MDS. And basically what it does is it looks at a few areas of cognitive function, things like recall and orientation and things like that. And if the patient score is high on the BIM, that means that they're generally viewed as not having a cognitive dysfunction. And we've gotten a slew of denials related to speech therapy being involved with patients that have high BIM scores. However, how do you combat those kind of denials, and how would you maybe help prevent those kind of denials in the first place? Well, the biggest thing you want to do to combat that is use a standardized assessment tool that truly rates the patient's cognitive status, looks at things like language skills, comprehension, cognition, things like that, because BIMS is not a standardized assessment. In fact, it's not evidence-based. It was designed by Medicare. It does not have any psychometric parameters to it. It is a screening tool that can be administered by, frankly, anyone. And if you've been in the nursing home setting and you've seen it administered, you're probably aware that it's not administered very well. And in fact, some MDS coordinators, and I know this firsthand, get the information for the BIMS from interviewing staff, not the patient, which is really what they shouldn't be doing. But anyway, it does happen. So how do you combat Medicare's assumption that a high BIM score means no speech therapy? Well, it frankly does, again, involve a standardized assessment tool, one that is evidence-based, peer-reviewed, that will demonstrate true cognitive-linguistic deficits. That's the only way you're going to validate why you're in, because you can measure somebody as being, let's say, minimally impaired in safety and judgment, or minimally impaired in recall, or something like that. But if that's all you're basing your assessment, treatment, goals, things like that upon, then it's not going to hold water. So we combat the BIMS with standardized assessments that are peer-reviewed. And in your assessment, you want to make sure, if you do know the BIM score, and this would be really helpful to you that work in SNF, to find out what the patient's BIM score was and talk about it in your evaluation and how that does not correlate, the BIM score does not correlate with the findings you're showing, because the BIM is very limited. In fact, you can Google search the BIMS, B-I-M-S, assessment, and there's a PDF version available on Google, very easy to find, and look at what it looks at, and then tailor your assessment to look at other things so that it's clear that you did consult with the BIMS, it was deficient in finding the deficits of the patient, and you are addressing the deficits that the BIMS is not picking up on. This would be a better approach than trying to justify your claim later on when you get a denial. So this is a current denial trend that we're seeing in the SNF setting, and hopefully this will be helpful to you in combating that denial trend. This has been John Adamson, the Rehab Documentation Guru. Please like and subscribe and suggest any subject matters you'd like to see covered in the future. We're getting a lot of new types of denials. Medicare is always looking for ways to say no to paying you. And so I'll be looking for other topics being covered in the future, perhaps very soon. Take care, God bless, and get paid for what you do.